My background is that I came into the NHS from university. I worked my way up through the hospital sector until I was chief executive of a hospital, and then I moved across to the second half of my career working at government level. I went out to the States and ran the global business for a big healthcare IT company, and then I came back to England to be Deputy Chief Executive and Chief Operating Officer for NHS England. So when I was thinking about taking on the role of the chair of a trust, I was very keen to do it in the community that I call mine, because I think to do this job well, it really helps if you know the difference between Uxbridge and Hayes. It really helps if you understand the importance of Ealing Hospital to the population of Southall and what their particular challenges are. The reason is to try and create an environment where our brilliant staff can deliver the best possible care for the whole of the population, and every one of our organisations has examples of absolute best practice, and make sure that that is available to everybody across North West London. So we need all of our organisations to be learning from each other and focusing on the patient, not on the institution. So my job as chair is to bring together a group of organisations working together to improve the health of their population and delivering something that is greater than the sum of the parts. Yeah, so my priorities for the coming year probably at three elements. The first is to get out into organisations, walk around the hospitals, talk to staff, hear what they have to say. We can't be brilliant if our staff aren't motivated and energetic and excited about what they're going to do. We need to give them a great working environment, and we need to get the right number of the right staff in. So that's going to have to be a top priority. I think the second thing is to turn outwards from the organisation to our community. As services have scaled back during COVID, we are now left with long waits for diagnostic treatment, outpatient surgery, and we need to get that back, not just to where we were before COVID, but back to something that we can be proud of, the sort of thing that we want for our own families. And then I think the third thing is to be working with the integrated care system to build a real partnership across primary care, community services, mental health, the voluntary sector, and local authorities to be delivering the best possible care for the local community going forwards. We need to make a fantastic working environment so that we can recruit and retain the best talent to North West London. We need to address the widening health inequalities that we see in our community and ensure that whoever you are, whatever language you speak, wherever you live, you have fair access to the best health care that the NHS has to offer. I'm excited about the potential that we have for bringing together our brilliant staff, the brilliant research that goes on, and the opportunity that new digital technologies have in order to create something that's really quite special and hopefully the best that you can see anywhere in the NHS. I'm excited to work with the integrated care system to drive forward a new way of thinking about improving the health of the whole of our population. And I think that the integrated care system and the organisations within the NHS, GPs and mental health trusts and community services, alongside the voluntary sector and local authorities, together we are a partnership that can deliver better health for the people of North West London, and the local people expect and deserve us to do a good job.